Give me a few minutes and I'll tell you about one of the wildest patients I've ever stitched up in the ER, and how it became the night I set my record for the most stitches I've ever done in a single shift. Night shift, trauma bay, calm as usual, until the patient comes in with multiple stab wounds. Just looking at him, I knew it was going to be a long night. He's homeless, drunk, barely coherent, and I have no idea how he got stabbed. My job? Make sure nothing vital is damaged, keep him stable, and then start stitching him up properly. Most providers just dive right in, but I take the time to do it right. That means making sure he's completely numb before each stitch, because rushing this can be painful and messy. So I get to work, hours go by, over 100 stitches later. Every single stitch is carefully placed, and I double check he's numb before starting each one. I remember thinking, wow, this is my personal record for the most stitches in one night. It's exhausting, mentally and physically. But there's something satisfying about seeing him slowly patched up, piece by piece. And yes, by the end, he's completely stitched together. Afterwards, I let him sleep for a bit, gave him IV fluids to help him hydrate, and even grabbed him a turkey sandwich. I knew he was homeless, so I wanted to make sure at least he had something to eat. Physically, he's fine, but mentally, he's not ready to leave. By the end of my shift, he's cursing at me, complaining that he doesn't feel ready to go, refusing to leave the ER. And I'm thinking, I cannot hand this over to the next shift. Well, no good deed goes unpunished, right? The next day, curiosity got the better of me. I walked across the street to the deli my friends own. They showed me the security video, and what I saw, honestly, I couldn't believe it. Turns out the reason he got stabbed is he peed on two guys outside the deli. Yeah, that's it. Those guys chased him inside, and it was like something out of an action movie. He tried to hide behind the counter, but they used everything as weapons: coffee urns, bagel knives, cutting boards, one even tried to lift the deli slicer. So, all those stab wounds I was stitching up, that's how he got them. And the more I thought about it, the more I realized I just spent hours patching someone up for something that frankly was ridiculous. I still remember thinking, wow, he made it out alive. And over 100 stitches later that night became the record setting night of my career. But the irony, I was being nice to him because he was homeless. And at the end of my shift, he's cursing at me for trying to help. Again, no good deed goes unpunished, right? And honestly, that's just one story. Working in the ER, every night, something crazier and crazier comes in. That night, I learned kindness sometimes comes with a side of chaos.